Great. Well, welcome everyone to our Grants and Sponsored Research Initiative, the GRIT Group. I'm Teresa Betancourt here at Boston College, and this is co-sponsored with our initiative on capacity building with Youth Forward and the program in Sierra Leone and Liberia, and also the Spirit and Essence U19 hubs at the National Institutes of Mental Health. And today we are delighted to have a dear friend and colleague, Jim Cairns, who's Director of International Programs and Shared Learning at the Harvard Center on the Developing Child. He provides strategic oversight to the center's international portfolio and is responsible for developing a learning community across a range of activities and partnerships in which the center is engaged. Prior to joining the Harvard Center on the Developing Child, Jim served as Director of Programs at the World Conference of Religions for Peace, coordinating global program strategy and overseeing programs in conflict transformation, peace building, child rights, sustainable development, and HIV/AIDS. So he has a lot of great international experience and know-how, which is super. Jim's background, he has master's degrees in international relations and theology from Yale and a bachelor's degree in government from Harvard University, and so also knows a lot about policy and policy translation. So we're delighted to have you here, Jim, and we'll turn it over to you.
Thank you. Thank you, Teresa. Thank you for the research program on children in diversity and the social work at Boston College. This is great fun. We benefited tremendously from having Teresa as an affiliated faculty of our center for many years. And so I've sort of been in many conversations with her as a lot of her work has developed in the past, and I'm excited to be here with the team and virtually with folks who are on this webinar. What I want to do is spend maybe about 40 or 45 minutes, and I have sort of two major parts of what I want to share coming out of the work of our center. And just to give a quick overview, the Center on the Developing Child at Harvard is a university-wide center, so we draw on faculty from across the university, I would say most heavily from medicine, public health, and education, but have faculty who've been law school, business school, arts and sciences, and so forth. And the core mission of the center has been to really leverage the science of early development from multiple disciplines, I would say heavily drawing on the biological and neurosciences, but not exclusively, and really trying to understand how that scientific knowledge base can be leveraged to drive for much greater impacts and outcome for kids and families, particularly those facing adversity. And so, as I say, we sit at the university, we have faculty affiliated to our center. I would say we have a very strong application and change focus. So we do not do a lot of research out of the center. A lot more of our work is, we started our first kind of 5 or 6 years heavily, and we continue to do this, very heavily focused on a kind of translation and communication of science and a kind of integrated knowledge base of what's happening early in life, and then how that can be deployed. And then really working in partnership with policymakers, program agencies, service providers, community members, philanthropists, and others to support a kind of a science-based innovation process for really trying to figure out how we can get better impact in the programs that we're running, and then how do we look at getting that kind of level of impact at scale over time. And so what I'd like to do is spend the first piece of this kind of talking about some of the core principles of the science of early development, and how we kind of think about and use that. And then the second half will be sharing a methodological framework that we've been developing that's trying to work with project teams in the design, implementation, and evaluation of new strategies, and trying to get at this question of impact in some new ways. So there's a vast array of science. We have been trying to talk about a kind of a core story of the science of early development. And we've even now tried to get that down to 3 key concepts that we think get beyond just helping people understand why it's important, and really trying to help us think differently about the solutions that we can try to get. So first of these is, and I don't think any of these necessarily will be surprising to this group, but we'll see. Responsive relationships and positive experiences build strong brain architecture. That we're at a point where all of the development that's happening, and particularly from birth onwards, although increasingly learning what's happening prenatally, this interaction between genes and environment, epigenetics, is at the heart of what's happening, particularly in the early years in terms of brain development and biological systems development in the body. And it's grounded in the sort of consistent responsive relationships that young children have with the adults in their lives. And that's actually what's wired in the brain. So that interactivity is building brain connections across cognitive, emotional, social, the different dimensions and functions of the brain. So that's the key concept number one. Second, there's a set of core capabilities that are critical for surviving and thriving in life. And that these often get talked about as sort of executive function and self-regulation skills. And that these skills are built. They are not self-developing. They are built through scaffolding and coaching and modeling, with adults doing that with young children. They can also be coached and built in adults. And what we find is if the adult caregivers in children's lives don't have these core skills and can't deploy them, then what we see is that we see deficits in children developing those skills. I'll talk a little bit more about what I mean, but those are things like working memory, cognitive flexibility, emotional regulation, and impulse control, and patterns and practices of schedules and those kinds of things. So one of the things our center has done for a long time is in a partnership with a group called the Frameworks Institute is to figure out ways to talk about complex science in metaphors and models that make sense to non-scientists and that help people think differently and in usable ways about that knowledge base. And so many of you will come to this in a little bit about toxic stress or brain architecture. These are metaphors that we've developed in partnership over the years. So when we talk about these core skills, the metaphor that we've developed in partnership with Frameworks is the idea that this is like the air traffic control system in your brain. It's how your brain is able to handle lots of planes landing and taking off on different runways. So how are you managing your schedule? How are you having to understand if option A isn't working, how you can switch to option B, how you need to regulate your kind of impulse control when you're in a situation of stress. So there are things that are shown here, the kind of behavioral control and so forth. So you can think about that metaphor if it's helpful, but the idea that your brain is really having to manage all of these different things, and these skills help that happen. And that these are foundational for success in school and learning outcomes. They're what help you keep a job as an adult, and they're what help you be a good parent. And so, again, here are some just more specific examples. The focusing and sustaining attention, setting goals, sort of monitoring your own action, delaying gratification, and so forth. So this is the second key idea. What's interesting is we're learning, and there's an idea in learning development called plasticity, that there are different periods of time when the brain is maximally open to be shaped by its environment. And it's seeking enrichment, it's seeking stimulus and interactivity. And what we find is that in these key areas of skill, there are two major time periods of this kind of enhanced plasticity or openness for gratification. One is in the early childhood 3 to 5 year old period. And basically what we've confirmed in brain studies is what your grandmother knew, or any preschool teacher can tell you, is that a 5-year-old can sit still and follow directions a whole lot better than a 3-year-old. And so what we're seeing is that these skills are rapidly being built in this first age period, but they are being built in that interactive relationship with the adults, parents, teachers, other caregivers. There's a second period of plasticity, particularly in the prefrontal cortex, which is the part of the brain that takes the longest to mature. And so this area between kind of 15 and 25, so sort of adolescence and early adulthood, again, is a place where the brain is receptive to skill building and coaching and sort of building connections around these kinds of skills. So if you think about it in terms of like almost evolutionary biology, that this is that period of time right before you have to ensure the next generation of the species is going to survive, right? So you've got to be able to have the skills to be able to parent, to manage your environment and so forth and protect the developing. So we have these kind of two windows of opportunity. And it's interesting that then for kids who themselves were in high adverse environments, didn't get maybe some of these capacities built younger, as they enter into adulthood, we have this second kind of window of opportunity. So the interesting connection potentially between kind of adolescent development and early childhood development and how we might think about some of the connectivity in those two age ranges. All right. The third key concept is that serious adversity disrupts the development process and the ability of us to use those kinds of core skills. And here's where we come to then the biology of adversity and three levels of stress. What's been interesting is the idea of toxic stress has taken off. It's been our most successful metaphor, if you will. What gets lost sometimes in that is that it was one of three levels of stress that were this sort of taxonomy of stress to help people understand what we were finding. Because when our communications research colleagues went out and talked to the general public about stress, one of the responses was, well, stress is a normal part of life. So why are you telling me that stress is, we all deal with stress, right? So here we go. So there's actually a positive level of stress. And this is about, we're talking about the biological stress response system in the body. Not so much the external source of the stress, but how we respond to a stressor. And so positive stress is help that kind of elevation of your stress system. You get, your heart rate goes up, palms might get sweaty, you might get a punch in your neck. But for young kids, this is managing things in their life. You have to take a nap. You have to share your toys. What it feels like the first day of preschool or daycare. But this is mediated through the presence of adult caregivers. And so you get this elevation, and then it gets mediated, and you get a sense that it calms down. And this is really important because it's helping kids, it's how any of us start to build our own coping mechanisms. We need this kind of stress in our lives because it's what helps us cope and manage stress at different ways. Tolerable stress is a much more serious stressor that is less temporary. So this could be natural disaster, a major illness or death in the family, conflict, the kinds of environments that you all are working in and your colleagues are working in every day. The key factor here is that this gets buffered by some consistent supportive adult relationship in the child's life. That even in the midst of a very significant adverse context, there's somebody who's helping that child regulate its stress response system. Without that supportive relationship, we then get to the level of toxic stress, which is a prolonged activation of the stress response system. It's kind of permanently on high alert. And there's not that buffer that's helping that child regulate its stress in a healthy way. And so what happens is that the stress hormones that are absolutely essential for short-term fight or flight survival kinds of responses, part of why we're all still here as a species, though if they stay elevated over time, they are actually toxic. They are corrosive in a number of different ways. One of which is they actually eat away at brain synapses. And particularly in areas of the brain like the amygdala, which handles fear and anxiety, and the prefrontal cortex, which is where these higher level executive function skills develop. So if these stress hormones, cortisol and others, are constantly flowing, they're actually eating away at the synaptic connectivity of those areas of the brain, as well as putting pressure, more sort of build up pressure on the inflammation system, the metabolic system, and so forth. So when we see markers of inflammation as risk factors for diabetes, heart disease, and so forth, this is part of what's happening in the body early on, and that's keeping, so you're seeing both short-term damage, if you will, and a kind of corrosive long-term impact from that persistent activation and elevation of stress. So we've thought then, okay, if this is the kind of core science, does this start to, we've had a lot of experience of people saying to us, wow, I get it, that's clear, I understand it, I understand why it's important, what should I do? And so we thought, well, is there something about these principles that almost become design principles to help us think about ways we could improve outcomes for kids and families in current programs and policies? And so, building responsive relationships, strengthening these core life skills, and reducing external sources of stress. That we think that, and these are all interactive with each other. And our hypothesis here is that if we're looking at our programs and what we're doing with kids and families through the lens of these three principles, does it give us a better chance of getting the kinds of outcomes for both kids and adults that we want to see? So for adults, it's this capacity to be able to deploy skills for responsive caregiving and economic stability. For kids, it's getting them on a foundation for their own healthy development and achievement in learning, and then later on in sort of economic productivity and health. That all of this is also driving long-term health outcomes. So as we see globally, the growing sort of burden of disease and non-communicable diseases, diabetes, hypertension, stroke, et cetera, depression, these kinds of things, a lot of that is rooted in this kind of early adversity. So thinking about this as, a way of again, kind of bringing a reflective lens to what we're doing already and saying, all right, so why are these important? So the responsive relationships, as we talked about, it sort of promotes healthy development of brain architecture, the stress response, these emotional skills, provides this buffering into challenging things. We also need responsive relationships for adults. So are the service providers also providing, what's that relationship? If I'm in the TANF system here in the United States, which is the welfare system, or any other sort of public services, what's my relationship with my caseworker look like? Is that supportive? Is it providing this kind of practical and emotional support, helping me build my own confidence as an adult, so that I can better both work and also parent? And these become ways of modeling positive relationship skills that I then can deploy in my relationships with my kids. And it's a stress reducer. The next skills, we've talked about this for the kids. This is where we're building these skills when they're young. Helps them in their own success. It helps them in sort of healthy behaviors as well as health outcomes. And these are the skills the adults need for workplace success, for providing that kind of responsive care to their kids, and maintaining a kind of stable home environment, makes them better citizens and community members as well. And that there's something that happens in the dyad as well, between this, in the interaction between adults and kids, this idea of agency and efficacy. I'm getting gratification that my parenting is producing something I want to see. And there's a stress management dimension to this as well. And then for the sources of stress, again, this is, we're reducing the risk of the stress getting to the toxic level in the kids, directly connected to brain development. I don't know if you've interacted with some of the behavioral economics thinking, this idea of bandwidth and capacity, so that what we find is that even if adults have these executive function and self-regulation skills, I think any of us will attest that when we're stressed out, we can't deploy those skills as effectively as when we're not. We're shorter with our kids, we're less focused at work, whatever it is, right? That's so that if the sources of stress in our lives are not as high and always present, it gives us more space to use these higher order kinds of skills and capacities. Problem solving, planning, goal achievement, and so forth. And it creates more space for this idea of responsive caregiving. We both have more time and more capacity to be that responsive parent or caregiver. So this gives you a sense then of how do you, and you can see how these three kind of relate to each other, right? There's a clear sense of how they interact. If there's less stress, I'm more able to deploy the skills I have and be a more responsive caregiver and so forth. So we really we're testing this set of principles out in a number of contexts and trying to develop some tools actually to create kind of a reflective practice process with policymakers, with program agencies. We've done a kind of a 6-month-long program with the Children's Home Societies of America, where they've gone in and looked at current programs that they run in their centers and kind of just tested them against these three principles and said, all right, we didn't realize that all the questionnaires we're asking our clients to fill out are actually increasing their stress. So is that mitigating against the impact we want to see in the actual service and so forth. So I think it's an interesting way to think about how the science would be helping us reflect on the work we're currently doing. Again, I think this is going to feel repetitive, but so this excessive stress activation is moving the response into the kind of automatic and less cognitive or controlled sense of the way the body and the brain responds. It's both in early childhood and in adulthood. So again, even if the adult has built the little gears on the right there, these more kind of sort of intentional skills, that when there's a lot of stress, that's getting overwhelmed by that kind of automatic response. Let me finish this part of the presentation by talking about the concept of resilience. All of these skills and what we've been talking about can help build resilience. We had a huge challenge in trying to figure out how do you frame talking about resilience in a particularly US cultural context. There's a very strong kind of dominant model that says resilience is a trait. You either got it or you don't. The science and the experts who sort of study the various dimensions of this are that that's not the case at all. And so we tried to figure out how do you talk accurately in terms of the science of resilience in a way that's also sort of understandable. So we've come up with this idea of a resilience scale. And so the simple idea is that the more positive things that are happening in someone's life, the more likely there is to be a sense of resilience. What are some of the things that help provide that sort of positive? And this is really interesting. It's responsive relationships, which wouldn't surprise us from what we've talked about. The supportive community. So are there services that help support families? Are things happening in the community that are reducing those sources of stress in people's lives? The idea of mastery, or again, back to this idea of agency, that is a help. But very clearly also faith and cultural traditions, that those are things that set a perspective for people, often give a sense of hope, but also a place and a set of beliefs that sort of buffer against difficulty and so on. There's one other really important part of this model, which is the fulcrum. So where the fulcrum is positioned on the scale is actually part of the genetic aspect of the genetic and gene environment interaction. So when you think about a temperament or other kinds of things that seem to be pretty strongly genetic in us, that what can happen is that fulcrum can move, or where it is positioned at the start can be different. And so even if you've got a situation where there's a fairly well-balanced set of experiences in someone's life between kind of positive or risk and resilience factors, if you could call them, those are other language words that get used here. Depending on where that fulcrum is positioned, you might actually see a more negative outcome and less coping ability, if you will. I don't know if you all have seen the idea of the orchid and dandelion kids. This is the orchid story, which is actually, depending on where that's positioned, there's a lot, the sensitivity to environment is much higher. And so they will react more negatively to adverse environments, but could in fact react much more positively in positive environments. So that's what we're finding though is, sorry, I'm going the wrong way there. You can actually move the fulcrum. that this skill building these areas of adaptive skill can actually, so that's again where this kind of gene environment, that the environment that somebody's in, and if that environment is helping build skills and these adaptive capacities, it actually affects gene expression. So you can actually move the fulcrum through skill building and coaching and so forth to encourage the likelihood that you're going to help people have more of these kind of resilience capacities, these coping capacities in their lives. So again, I'm just going to, this is an idea then of how, just again, ways you could look at these principles as a lens of kind of reviewing current policies, looking at what kind, if you're planning to do a new part of a program or a service, does it open up, oh, actually, there's something new we should be doing in our work because we just realized we haven't paid any attention to whether this program is providing a reduction or not of the kind of stress. And how do you start to look at the way they might interact with each other? So as you start to look at impact, are you measuring or trying to look at or assess the ways that these different principles are interacting with each other? I'm going to pause here. This is kind of the science half of the presentation, and just see if there are, online or hear some questions or reactions to some of this before I move into the second part.
I had a question. This is great, Jim, and it's definitely influenced our work. And you'll note, all of you in the lab, so many of these themes coming up again. I think that's also why we're looking at the integration of things like poverty reduction strategies with an early childhood development home visiting program in Rwanda, or the integration of evidence-based youth mental health interventions for young people exposed to violence in Sierra Leone with youth employment and livelihood programs, because you're looking at those sources of stress related to poverty, as well as now having a delivery system for reaching the most vulnerable because they're being served by these programs. And we're bringing in the evidence-based home visiting ECD program or the evidence-based mental health program into those platforms. I know that with frameworks or maybe another consulting group, you had looked at some of the global translation of these concepts beyond a US environment, because things like serve and return or air traffic control, when you're in a village in remote Sierra Leone, tennis or air traffic control are very strange concepts. So what have you learned about some of the transportability or what new metaphors are required for taking this communication strategy globally, especially to very low resource settings?
Yeah. Are there any other questions coming up?
Not online.
Okay. So frameworks is very clear that they don't like to be called sort of communication researchers. They are a kind of mixed method social research shop, heavily grounded in cultural models anthropology, but also drawing on linguistics and sociology and a range of other so they have a team of researchers who bring different disciplinary expertise. And at the heart of their sort of methodology is this idea that we all carry unconscious cultural frames through which we receive any new information. And so to cut it short, if the facts don't match the frame wins. So the great example on the stress stuff is all the sort of neuroscientists and experts that we work with. We're talking about the deleterious, impact of stressors in kids' lives. That doesn't translate very well. So Frameworks goes out and they go out and do focus group surveys and people on the street interviews. And what they found out is that I can't talk about stress. I can't communicate effectively this scientific knowledge based on stress because there's this cultural understanding of stress and to pull yourself up by your bootstraps and all this kind of stuff in a US cultural context. So we've got to find a way to communicate this through a metaphor that gets around or helps reframe the way people understand the information. So they are very culture specific in the way they want to do their work. So they get very twitchy. We say, well, we'll just go, you go use these, this stuff someplace else. I'm like, no. They now have done work on early childhood in about 6 or 7 countries. We worked with them extensively in Brazil as part of a collaboration we've had in Brazil for a number of years. To Teresa's point, one of the things that came up there was the serve and return. They could translate it, but what they found was there was a local Portuguese Brazilian term called bate-bola, which had 2 meanings. One was just the way you pass a soccer ball back and forth. So the sport metaphor was much more understandable. And it's the idiom they use to talk about TV talk shows. The host of the talk show and the way they interact with their guests is very... So that carried strong resonance in a Brazilian context, that if you say bate-bola, everybody's going to know what that feels like. We were working with folks in Mexico with the same kind of hypothesis that there should be some other kind of metaphor. They couldn't find one. So we ended up doing a straight translation into Spanish of serve and return. And we're still not sure it really works, but it was an interesting contrast, you know? So Frameworks has worked in Bangladesh. They're working in Bangladesh right now. They're working in Kenya right now. They work in South Africa. A lot of work in Canada, Australia. So they're starting to build a body of evidence. And what they'll do now is, because so many of these kind of models and metaphors have been established, is they're both testing those models in terms of their communicability in that context, as well as trying to understand whether there might be other dimensions of the child development story that need a new or different metaphor for that context. So for example, in Brazil, there's a very strong cultural model that learning happens at school. So there's a very clear sense of parents of very young children that they have very important responsibilities for the social and moral development of their children, but no sense of their cognitive development. But that happens when the kid goes to school at age 6. So they're trying to figure out a metaphor for the role of the parent in building the learning of young children. And they came up with the learning canoe. And I haven't found out how well but the idea that the child is rowing in the front and the adult is rowing in the back. And that part of what the adult, you're giving the child a chance to practice some skills, but the adult is there to steer and guide and kind of scaffold that. So anyway, so again, an example, they found that there was, in the particular cultural context of Brazil, this problem that they hadn't run into in the kind of cultural context in the US, and they wanted to kind of figure out and test a new metaphor. So that's the kind of work they do. So we also find that, you know, in a general sense, a lot of this, the core science part of it translates pretty well across. We continue to be surprised about where our videos are being watched around the world.
So we watched them in Rwanda.
Mm-hmm.
Yeah. Retranslated them? Informally?
No,
Okay.
they're doing a live translation.
Yeah, like a simultaneous kind of
Yeah.
informal interpretation.
Yeah, we usually go through them with the supervisors, so they have a good understanding, and then they're the ones training the community lay workers. So.
And also the metaphor they use in Kinyarwanda is about rolling the ball back and forth, not serve and return. And that has salience there. So, other comments, questions on this portion? No?
Good.
Yeah, I mean, I'd be interested as your Kenya and South Africa work with Frameworks goes forward, what you're learning
So if
from
you
an
go to,
African
so
context.
it's the Frameworks Institute.
Okay,
On their website,
okay.
they have a page that is all of their international child development research.
Mhm.
And they usually do 2 stages of work. They'll do what they a kind of diagnostic stage, which is where they kind of map the gap between the scientific expert story and the kind of cultural understanding of an issue. And then they will do a more prescriptive piece of work, which is then sort of testing and developing the metaphors for how you would frame the story of child development for that particular culture. So the first piece of the work in South Africa is done. It's on their website. So that might provide some interesting, I don't know if they are doing or if they have finished the second piece. The Kenya work is still in process.
Okay.
So, but happy to share that. But
Yeah.
keep it, you know, and again, all of the work they've done in other parts of the world is on there.
Do you know if they've done much on mental health?
They have in the US. So the idea, the kind of metaphor, which our folks didn't love, but was an idea of levelness, the metaphor of a table, and that if you've got a leg on the table that is not the same that you get. It's wobbly. So those materials are all on the website as well on mental health, but I don't think they've done any internationally. Maybe in the UK. They're doing a lot of work in the UK right now.
Because we were wondering about doing something like that on global mental health, so that's great to hear. Super. Thank you.
All right. Shall we move?
Yep.
So we are also now using the science to make a case for why the field of early childhood needs an innovation agenda and the capacity to innovate in ways that it has not in the past. And so what we've seen is, and this is, I would say this is heavily US based, so take it with that bias, and whether or not you see this as ringing true in other contexts. But that for a long time, our primary question has been, can intervention and prevention programs improve outcomes for at-risk kids? And generally, we've answered that yes. There's enough evidence that programs make a difference. And classic research models, randomized control trials, longitudinal research, and so forth. But what we're seeing is that those effect sizes have tended to be modest and have not particularly improved dramatically over time. And this is I'll explain this slide in a minute here. So one of the programs our center sort of hosted several years ago was a meta-analysis of 50 years worth of program evaluation studies in early childhood programs in the United States. So this graph is taken from that analysis. So what it shows you is any center-based early childhood program that got evaluated, and that study's in there in that meta-analysis, and that's what each circle represents. You see that the red circles were specifically of Head Start programs. The size of the circle is the number of kids that were in the study, and then you see across the years. The two circled studies up at the top left, Perry Preschool and Abecedarian, are kind of the models of impact to prove that we can make a difference in sort of early stimulation and early education and so forth, and with strong results. The yellow line is the average effect size over time. And so what do you see about that line?
Goes down slightly.
Is this adjusted for the initial sort of adversity of the population though? Because depending on if it's a universal program or an indicated select program, they're taking a really high risk. You can really rejigger things to get to
one of the major variables that is reflected here is the fact that as you move temporally, what the control group is getting, what standard service or care has expanded over time. So when you look at the late 60s when Perry's Preschool was operating, the control group got nothing. By the time you're in the 80s and 90s, the control group is getting something. And so that's clearly a factor in terms of the fact that you're seeing a kind of a look. But the major thing is that in 50 years, this is a field that has not increased the kind of core level of impact it's having in terms of outcomes for kids. And so this was one of the findings, I would say, that really propel our center to kind of shift our core mission to think about how the science can drive innovation in this field for impact. And so we think a lot of this is a precision problem. What do we mean by that? That the way we've evaluated programs over the last half a century, tends to look at how programs work on average. You get an average effect size. If it's positive, you can declare yourself an evidence-based program and say, hey, we have evidence this works, and go do it. They're often also multi-component programs. So they're complex in terms of what's being implemented, and the evaluations are multi-dimensional. So a whole lot of stuff gets measured. So what we often don't know is what it was in the intervention that produced the impact and how it works, what the kind of mechanism is that's going on in the program that produced the result that you got. And we know even less about for whom it really worked or who we did what we might call a segmentation kind of lens on this. So what we're trying to do now with the center, and we have what we call the Frontiers of Innovation, which is our kind of innovation platform where we're supporting this work, is we really want to start to ask different questions about our work. What about it works? What are the key ingredients? Because that helps us understand how we can replicate and scale. Because if you had a kind of well-resourced, highly controlled pilot, you are not going to be able to replicate the resource inputs for that at scale. So you got to figure out what are the essential pieces of what worked. So how do we get at that? How does it work? What are the kind of mechanisms? What are the targets that were really sort of the focus of the program, and were they changing, and what was changing? And then this idea of how do we start to get into the idea of differential impact? Things work really well for some kids and families. They don't work very well at all for others. So how do we know who's responding, and how can then we adapt and target more effectively to really get better impact? And finally, in what contexts? Can we understand the contextual factors that are affecting these other questions in terms of how it's working? Is it implementation challenges? Are there other contextual factors affecting results? So it's getting away from does it work to what about it works? How does it work? Where does it work? For whom does it work or not? So that's kind of, if you want kind of our new mantra, this is the song sheet, and it's really what's driving a lot of what we're doing. And just to kind of sort of bring up a point to this. So here's a study, random, this was sort of the outcomes of this. So that's your mean effect size, right? It's positive. But the question we want to ask, we should be asking, is this question. Why did it work really well for these kids? And why did it work so poorly for these kids? So when we think about trying to get to impact at scale, that the impact part of this is, so what should we do? Well, let's think about really figuring out what are the moderators or the characteristics of this particular group, and go to town on that and get that to as many folks who look like that group as possible. The folks down here, clearly it's not working. There's something else going on there, so let's figure that out and adapt and test some new strategies. So this is kind of the mindset, both the challenge and kind of what we're looking at that's now driving our, and then what you need is a portfolio that's varied, more targeted. You'll see in a minute, we are starting to use a word, we're not sure we like it, but it's what we're using, modularity. The idea that what we're looking for are components that can be put into existing programs and services that get better impact. Not necessarily we have to create an entirely new program and scale that, but there are ways to improve components of existing work that are already serving large populations that can get you impact at scale without having to kind of scale, quote unquote, something new. So this is the approach. We're calling our ideas impact framework. Is a structured but flexible approach to facilitate the development, implementation, evaluation, and iteration of programs. And we acknowledge that this is not, the methods and tools we're using are not new to this field. I mean, this is not something that somebody imagined sort of in brand new, but we're trying to deploy them in some new ways and in a much more specific way. And with a process that helps us get beyond the average. So, Ideas Impact Framework stands for innovate to solve unmet challenges. And just to say that the process of really getting specific about the challenge you're trying to solve, this idea that being, we like to talk about being constructively dissatisfied, is where are you seeing or not seeing the kinds of results you want to see, or you're seeing families that just aren't benefiting. What's that challenge? How do we get in there? And then how can we innovate to kind of try and solve that particular challenge? Develop a usable program with a clear and precise theory of change. Evaluate that theory of change to determine what's working and not, for whom and why not. Adapt it in a more rapid cycle, iterative learning approach. One of the challenges of the kind of randomized control trial process is you get fixed into a protocol for a long period of time. And even if you're seeing things that you want to tweak in that model, it's hard to do that within the protocol of that kind of study. So before that, and those kinds of studies are still important in terms of building our evidence base, but are we able to create a more iterative and adaptive learning set of cycles that get us to hone in and really understand what's going on before we move to that, and then scale what looks most promising. Took us about a year to get that acronym worked out. So that's the model. So let me talk about what it is. So it has a set of 4 guiding principles and 3 components to the methodology. So here are the guiding principles: idea of precision, this fast cycle iteration, idea of co-creation, that there are different sources of knowledge and experience that if they're brought together, get you a more effective result, and shared learning. So with precision, this is where we're trying to get into this idea of really getting clear and accurate about what the program entails and what parts of it work. This segmentation idea of really trying to figure out and learn about who it's working for and who's not, in which contexts. This idea of modularity that I just talked about, that these are components that can kind of get plugged in, combined, recombined based on what we're learning about needs and challenges and impact within a population. So the iteration, I think we all understand. We've started working with some folks in the social entrepreneur space, and we always get the question, what's fast? Fast for them and fast for us are very different. They're iterating every 18 months or 18 weeks or days. And you're like, for us, we're lucky if an iteration is 12 months, but that's still better than 3 years. So it's relative, but it's the idea that we're really trying to get into this cycle of really doing as much as we can, 6 weeks, 8 weeks, learn from it, see what we're seeing, adapt it, go back, iterate again, and continue to move towards higher levels of. So, a lot of the groups we're working with right now are kind of early stage design and development. And so how are you doing these kind of small scale pilot tests to establish just feasibility and start to explore what we're seeing. And then again, every cycle gives you a chance to refine, incorporate the learning, and then move it towards higher levels of evidence in a more accelerated pace. Co-creation is just that there are researchers, service providers, community members, clients, all bring their own perspectives to the challenge and to the design and implementation and evaluation of a program. And the more of those perspectives are sort of part of the team and the process throughout, we think the better the outcome's going to be. So our Frontiers of Innovation community is really trying to kind of support teams to have those different voices in them and to bring together folks throughout the process. And our hypothesis here is that this is more likely to actually meet the needs and challenges that communities are facing in real world contexts, and that they have some feasibility to go to scale. And then finally, an idea of shared learning, that we need a community working across contexts. This is a complex, multifaceted, human development is complicated, and so we need the ability to learn across sites, across sectors, across geographies. This is a mantra that we continue to find hard to do, which is, how are we really trying to focus on failure as a learning mechanism, and to, if not celebrate it, at least not be afraid of it or ashamed of it. So we have 3 components of the framework. So let me sort of walk through these, and I think then we'll kind of be it. So the first is a theory of change. Now this is a term that is all over, can mean 100 different things, and so we have not invented the term, but I think what we're trying to get at in the way we talk about theory of change in this framework is really getting about what do we believe is going to happen in terms of very specific changes in outcomes as a result of the work we're doing. We think that it helps foster this iterative learning cycle because it's helping us get more precise about our hypotheses about for whom this will work and why and how. And we also feel like it really facilitates shared learning. Any project team that's working with our Frontiers of Innovation kind of in our portfolio of projects, which we're giving technical support and some seed funding to, they're all using the same, you'll see in a second, same theory of change template. the fact that they all have the same template allows them to kind of talk the same language with each other and facilitates that kind of learning. Which is the next point. So here's the 4 components of our template. So there are strategies, which are the actions the program takes. So it's 6 weeks of home visiting. It's a parent education program, whatever it is. These are the actions. Talking about targets, what are the knowledge, skills, and behaviors that your actions are directly targeted? So this is in the caregivers, in the adults, in the child, and also in the interaction, the diet. And so this could be anything from increase in amount of time parents play with kids. It could be the caregivers' attitudes about play as an important part of early learning, those kinds of things. And then outcomes. So if we see these, and so the targets are sort of the things you should be able to measure pretty immediately after you've done your actions. So change there. And then what are the longer term outcomes, the ultimate goals you want to see in terms of functioning over time? In terms of the caregiver, it might be executive function skills. It might be a reduction of stress or depression. In the child, might be learning outcomes, child's own executive function skills, and then what are we seeing in kind of sort of responsive interactivity and caregiving, perhaps in the diet. And then the last piece is an idea of moderators. And this is, what are the factors that could affect who is benefiting most and least? And the idea of starting to do some serious thinking about this beforehand, as opposed to when you see in your data analysis the 3 things that showed effect sizes, positive effect sizes, and then trying to figure out why. Just start, all right, what kinds of things might be shaping these? And I'm going to walk through each of these pieces just in a little bit more detail. So strategies, again, these are the actions. They can be person-based, they can be place-based, and they can be technology. We're starting to work with more teams who are actually doing apps and websites and stuff like that. And this is trying to move us from does it work to how does it work? And so here you go. So a person-based example would be, the teacher in a classroom is introducing gameplay with increasing levels of complexity. We're working with some community-based things that are actually doing sort of playful bus stop installations. So that would be an idea of a kind of a place-based strategy. We're putting a playground in, or we're doing something kind of at the. So that's an idea of what would be a strategy. Target. So these are the things that you're really trying to directly target from those program activities. You'll see when we get to the next component of our approach that these are linked very carefully to things that are in the program materials, and that this is where we would want to see kind of immediate impact. So reduction of harsh discipline, improved coping, social skills in children. Is there longer or more time spent in terms of parent-child interaction? Those kinds of things. And this is then moving us to sort of, what about our program is working? Not just is it working? Outcomes. These are the long-term changes we want to see in terms of functioning. And again, these are they're important on their own. They're not sort of a step along the way. So again, some examples here: improved mental health, parenting stress, reduction in child behavior problems, improved language development, and so forth. And then for moderators, these can be both person or place-based factors that we are hypothesizing could affect impact in terms of who's benefiting more or less. It can help us explain individual differences in response. So things like some of our programs are really seeing clear distinctions if adults in the program have a high ACEs, the early childhood adversity in their own, that is a moderator of, in some programs that actually they do better. They're having more impact for folks who have a documented history of early adversity. For others, it's worse. We could look at sort of age of the child. We could look at other kinds of things. And then we're looking at sort of place or context-based factors. And this could be level of training of your service providers. It could be lack of transport. It could be a number of other things happening sort of in the environment or context that are affecting the ability of people to benefit from a program or to participate in a program. So that's the idea. Like I said, from my experience with other things that get labeled as a theory of change that tend to be more a mapping of kind of a program implementation process in some ways. I think we're trying to get at the mechanisms a little bit more explicitly so that we can really understand and kind of get inside a kind of black box of, well, we did these things, we got these results, but we're not quite sure what that causal pathway is. And so this is a way to kind of push that kind of clarity and specificity. And now, again, this is the going from does it work to that idea from will. I'm going to quickly then program materials. This is the idea of a usable program. So the more that you're getting sort of tacit knowledge out of people's heads and into clear program materials, those can be training guidelines, they can be curriculum, they can be whatever else that's just sort of making things explicit, and then they become shareable. They're teachable, people can use them in other places, people can learn from them, and they're actually implementable, doable, and they're accessible in real world context. So the idea that we're really trying to, and that the program materials, if you're building a curriculum, is it focused on the things you've said you want to target in terms of changes in your theory of change? So this idea that they're kind of closely related so that you're at the end of the day, if your curriculum hasn't been explicitly sort of connected to your theory of change, your program strategies and your targets, and you measure stuff, you don't know whether your curriculum actually changed those targets or not. So it's this idea that you really want to kind of get those things in sync with each other. And again, implementation checklists, fidelity scales, staff training, materials for participants, your website, your app, those kinds of stuff. And finally, the evaluation plan. And again, really getting what you're going to measure to be specifically focused on what you're targeting and what you want your outcomes to be, and not everything. And the evaluation is to really investigate the theory of change, and is it accurate? What do we learn, and what are we learning that helps us then both possibly go back and change our theory, and continue to kind of get into this iterative cycle of constant improvement. So that's the ideas impact framework that we're trying to support teams. So we're actually, I was saying, I stepped out today from we're running a 2-day workshop with 9 project teams who have a technical person sitting, and they're walking through this whole framework for 2 days. And we do a one day kind of training that's a more didactic presentation of a kind of in-depth overview of this. And then some teams continue to kind of work with our technical support team over time within FOI. So the last slide, for those who are working in international contexts, if you're not familiar, you've probably now been seeing this. But the Lancet series, a year and a half ago, had its latest series of papers on child development in international contexts. And they put forward this conceptual framework of nurturing care. And the World Health Assembly, sometime later this month, is about to vote on a formal sort of endorsement and a whole framework around this model. And so you see the domains there. And again, trying to kind of bridge this sort of stovepiped global development, health sector, education sector, social welfare, there's, so health, nutrition, responsive caregiving, security and safety, and early learning. Part of what I've appreciated about this is I think that there are very strong echoes in this as a kind of programmatic or policy framework of those core science principles, I think for the first time. I think there's a consistency or resonance. So particularly for folks who are on this web call and for your partners and as you work in the field, this is going to start to become, I think, a pretty strong framework in terms of the way that public systems and governments start to talk, and in the international agencies, this is going to become kind of the new language of UNICEF and World Health Organization and others who in World Bank, So I just wanted to sort of, if you're not aware of this, this is, and I think within a couple of weeks, there probably will be an entire sort of web page on the WHO website that has the whole kind of framework of this. So I will stop there. That is, and then just finally, if you don't know our website, there's a ton of stuff on there, on the science and on some of these other issues.
Wonderful. Thank you, Jim. Thank you very much. So we're at time, so I want to see if there's anyone online, because we want to make sure anyone online has a chance. Do we have any questions?
Nothing in chat, so.
Okay, so others, yeah, Rebecca.
I have a quick question. I appreciate the rapid cycle evaluation methodology. I know that's sort of a thing now. It concerns me a little bit from a developmental standpoint. I think that, but I'm not sure if it's that, the evaluation methodology that's the concern, or the lack of rigor of our theoretical models. By which I mean, if you look at the most impactful programs and evaluations that have occurred over the past few decades, so Carey, Avisteri, and Head Start, many of them were targeted at a particular set of skills, mostly academic skills, and essentially all of them found that their initial impacts faded out relatively quickly, but longitudinal work has shown that you get very substantial impacts in adulthood. The concern is that if we're doing this rapid cycle evaluation and we're targeting these short-term outcomes that we think are most directly related to the program, and then shifting the program in response, we could be missing these really key long-term benefits that are driven by processes that we hadn't adequately proposed in our theory of change. I guess it's a limitation of our theory of change, which is a limitation in the underlying developmental theory of trajectories across domains. But so do you have anything to speak to about that with the rapid cycle evaluation? And
I think it's a sense of,
it's a rather long-winded question.
no, but I get what I totally get what you're saying. I think it's more about that those cycles help us get clearer about what's actually happening in the program in the short term. I mean, in our actual implementation of it, and what kinds of results we are or are not seeing, so that as we continue to move towards longer and more rigorous kinds of evaluation over time, we have in a sense, we not only have a better bet that we're going to have impact, but we can actually tell people why we're getting the impact that we're getting or not getting. So that as you want more kids to get that program, the sense what it is that are sort of your key ingredients or your
right.
So I think that the other dimension, and Jack Shonkoff, our center's director, has been pushing, I don't know how successfully, to say that this scientific knowledge base is another form of evidence. And so that there's a cumulative body that says, if we know biologically from these things that if there's, if you're keeping stress levels down, if you're increasing responsive caregiving, then over time, there's a pretty strong hypothesis we're going to see better outcomes, right? So it's I think the combination, so that it's not that we're maybe we're able to do more of this because we've got a history of these longitudinal kinds of studies, and so it's not an either or. I think it's a both and I think it's the sense that for all kinds of reasons, good and bad, there's this sense in human services and child development and so forth of sort of being satisfied with mediocre results, or we get really good results and then we try and replicate it and do it for more kids and we don't get the same results and we have no idea why. Right. So I think that's the driving kind of push.
Can I ask a bit more targeted follow-up question? In your experience, is the rapid cycle evaluation methodology used more typically in sort of a process evaluation framework? So you're doing this rapid cycle evaluation shift in terms of whether the program is functioning as it's meant to function, or in terms of the actual interim outcomes?
It can be both, but so I think part of this is, so you might be right, some of this is just feasibility, right? Is it doable? Can people come? Do they stay? Can people deliver it? Do you have, drop out of your teacher, whoever's, that kind of stuff. And then once you get a sense of that, okay, or whoa, we thought we had 20 parents who came to this and only 10 stayed for through session 5. Why is it? Go back and find out. We have to tweak. So once you get kind of, so and then the next thing is, okay, let's actually start to look at our targets and start to have some assessments just of the targets. Are we hitting our targets? Yes or no? So it's that kind of iterative, and you're kind of, as you continue to build it, you're getting more rigorous. You might be working with more participants. You start to then move to more sort of control and intervention group kind of studies and things like that. But it's this idea that before you do that, you want to make sure you actually do understand, right? This kind of more implementation, feasibility kinds of questions, before we spend a huge amount of time to go out and really look at our outcomes. If we're
because the old model, you do sort of a 3-year intervention and you're doing both at the same time, and at the end you find out that the implementation was weak and hence.
Right. Or you got outcomes, but you can't actually trace back to what it was that you did or what behaviors you changed that resulted in those outcomes as much. And then it just, you can't go anywhere with it, right? I mean, or you get the sense of, wow, we have, this is an evidence-based program. It worked. We're going to give it worked for, on average for these 40 families. So now we're going to scale it across the entire county and obligate every family that's in this, receives this service, they're going to get this intervention. We don't have any idea, or we haven't gotten clear about the fact that actually this might not be the best intervention for a third of this population. And so why are we spending money giving it to them if it's not going to help them?
So I'm wondering if you can talk a little bit more, like using maybe a concrete example from some of the programs that we've worked with about that fast cycle iteration. I think even as like Jenna, who's talking to some of the community volunteers in the field that are actually the interventionists, may come back to the team and kind of highlight certain things that may be kind of problem spots in the intervention, or may not work with a particular community, or that community might, there are certain barriers to the intervention working in the way that we expect it to be working, which is all hugely helpful information. But then I think there's a tension there between having that information come in, and then, for instance, partly my role as an evaluator, to say, okay, this is great information coming in, but don't change anything yet, because we still need to be able to see whether it's working without changing things every step along the way, because then we don't know what it is that affected that change. So just having a sense, kind of a more concrete sense of how that fast cycle iteration works in practice would be helpful.
Sorry.
Yeah, sorry.
Yeah, and while he's chewing, just to distinguish, like in our lab, what you'll often see is pilots, often several pilots.
Right.
So like the youth readiness intervention has 3 pilots at this point.
Right.
And every time we are iterating, we're, it's modular, we're adding in something, we realized maybe we didn't hit depression as we wanted, we added back more self-efficacy components. And then we tried to integrate with the youth employment platform, found out there were issues with that integration, made modifications way before we went to the larger cluster randomized, fully powered. But even when we go there, it's a hybrid design. And that's an implementation design where you're simultaneously, you have 3 types of hybrid. You can do hybrid 1, which is where you're studying primarily effectiveness with a small process amount. Hybrid 2 is when it's equally weighted, that you're looking at implementation strategies at the same time that you're doing effectiveness. And hybrid 3, where you don't worry about effectiveness anymore, it's pretty established. Now you're really doing full implementation as the main focus. And a lot of our trials are hybrid 2. So oftentimes we've done several pilots, faster cycle, but fast is relative. Iterating, refining, and then we're going to a hybrid design where we look at well-powered effectiveness, but we're also looking at implementation questions around barriers, facilitators to doing this, the context, how to adapt to context. And in the current trial in Sierra Leone, we're studying interagency collaborative teams as a strategy for sustaining quality and quality improvement. So I'd also be very fascinated to hear just how you situate yourself with relation to implementation science and its theories, its tools, its methodologies, and even hybrid designs.
And I'm not this is not my area of expertise.
I've learned enough of it to be dangerous, I guess. Or to have an opinion that probably is not grounded in legitimate knowledge. So I think that we are curious and probably need to do more about engaging deeply in the implementation science space. But like Phil Fisher, who is kind of our guru of this framework, he's based at the University of Oregon, but is a senior fellow at the center. I mean, he talks a lot about that. There's a lot of stuff happening in implementation science that kind of needs to be incorporated and brought in. So I think there's interesting space to learn there. So I think one of the challenges has been that the way this work gets resourced rarely allows for time and space to do more of the piloting and feasibility and sort of this more iterative process. So then it comes to other kinds of creative study designs. I mean, other colleagues have talked about sort of third arm, or where you've got a couple of sites that are 6 months ahead of the other sites, so that you're kind of piloting and testing, and that's getting incorporated back in a stepped way, so that your fidelity to the model in the actual evaluation is still maintained. But a lot of this is creating time, resource, and space before, for however long. And and gradually we're seeing a little more sort of money, and that's what we've raised money to buy out teams' time to be able to spend time doing this level of 10 families, 30 families, 3 cycles over 18 months, just to kind of get in and figure it out and help us figure out some of the framework. I mean, this framework has also been kind of evolving and iterating over the last 3 or 4 years as well. So I think it's part of the, but for example, one of the pilots in the FOI community was doing a kind of rule-based game playing intervention in a early Head Start, high-risk family kind of setting in the state of Washington. And they were able to run this with, I think they did 20 years, parent-child kind of dyad kind of program. And they ran their first kind of 10-week cycle, and were already able to see that they had a significant variation in terms of outcome, or whatever they were measuring with the kids. And we're able to pin it back to the fact that kids who were showing a low baseline level of attention skill couldn't benefit from the executive function oriented game playing intervention. And so they were, all right, well, we need to screen sort of on attention, and kids who are showing lower levels of attention skill, we're going to do some other kinds of things first to help kind of work on that, so that they can benefit better from, from the, so that's the kind of, but again, that's a 20 family thing. They had funding for 6 months. They were able to do that. Then they got funding for another cycle. It's not huge money. It's $30,000-$40,000, but we've got to go out and raise that. And we've tried, and, and we're working with, there's starting to be some more private foundation philanthropies, folks who are at least, we've convinced to give us at least some money to try this. So, but yeah, it's hard, because that's if the funding is, this is the model you've got to sort of, deploy.
The rapid cycle, from like a public health standpoint, is like a PDSP, plan, do, study at PDSA, that like I work in a hospital. And I kind of think that, like, for our programs, if we're going to change something small, but it's not fundamental to like the design of it, like allowing families to meet in the Dunkin' Donuts rather than at home, when the home was the original model, it's a small change. I think, like, ideally, if you were going to make, like, when you make little changes like that in a hospital, you might do a little bit of testing with a very small sample to see if putting more soap in the bathrooms and, impacts beer, right? So, which we don't have the capacity to do with every little change like that I might make along the way. But I think if it's not really integral to, like, the core of the intervention, it's okay to not check the data at that often to compare.
We do a lot of that kind of rapid cycle tweaking during the pilot. Like, the whole pilot is just like, okay, this is not working, try something else. And we just own the fact that the pilot had a lot of iteration going on.
Right.
And that's where at the refugee home, visiting your, examples of people, being able to meet in the kitchen. You know, we never anticipated we'd run out, you know, that there were no rooms in the house where it was okay to have the session because there were too many kids and you couldn't get privacy. And then trying new spaces, try and come to the office, try and come to the rec center within the housing project. That's sort of how we always have been approaching the pilot. And then we might change the criteria when we go into the bigger trial and say families, you know, met in either blah, 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 because we've kind of tested that out in the pilot. So I think that's definitely part. Another thing we've been doing is a lot on fidelity. Lots on fidelity monitoring, because we're finding in very low resource settings, and Jordan's really spearheaded this and can tell you more about it in Rwanda, you know, just going through a several week training with community-based volunteers is just the first step. And there's so much is on the job learning. And what we started to do is audio tape them when they went to the households. And you hear all the ways in which things go off the rails. You know, we had home visitors who just would show up and read the manual out loud, even though they looked good in the role play and they sat through your training, but you don't catch that unless you have mechanisms to monitor quality and engage in cycles of quality improvement. So we've really stepped that up because a lot of our programs are using lay workers, you know, to get the models out there.
But that's an example. The data might be different pre-recording, post-recording.
Yeah.
But I think the nature of this type of work is okay.
It's a part of what we do.
Right.
And when we give it to the
Where other
government, we're
research
trying
may
to
not be.
develop sort of transportable, usable fidelity monitoring tools, knowing the government won't audio tape. But what if we got some cartoon checklists out of this in the end? At least said, please be sure that you're doing this. You know?
I think that's where, so the history behind the model is that when we're starting the Frontiers of Innovation, the idea was it'd be great to have a data repository. And if teams would be willing to share the identified data, we could start to aggregate across small pilots to see if we were seeing trends and be able to understand, you know, what's proving to be more effective and things like that. So let's just do that. So, but then, you know, you realize we're doing this technical support kind of on a one-on-one basis with teams, and so people are having phone calls every, you know, and what they realized is that the data by itself wasn't going to be it. Just these other pieces of the kind of the model started to evolve, and the program materials piece has been interesting, and to this exactly to that point, that if you don't have a set of materials that make the program usable for somebody else, and what are the kinds of pieces that you need to actually spend time building out, and that's it. And the fidelity checklist is a big one that we're working with teams on, and just, you know, is your program guide clear, and does it articulate what it is you're actually trying to target and things like that, and is your curriculum, you know, aligned with that or not, or are you running all kinds of activities in your play center that aren't at all connected to actually building the skills that you say you want to go build and measure and have outcomes on. So it's just, yeah, that intentionality is
I have another question.
Yeah, sure.
On the graph where there's the people or children in this case, the early intervention performing really well and the ones that did not, and then you're going to scale up with the ones doing well, the same thing, and then tweak it for the ones that weren't. Do you look at commonalities among the ones that weren't to figure out what factors they share that could be why they didn't succeed in that, whether, and then, okay, so then how, I guess, how do you identify those? Do you go back to doing like qualitative or quantitative work to figure out what those are? And then how do you know which ones might have had the impact that you're now going to try to address?
So there are a couple of ways. One, by really putting the moderator component in our theory of change template, is trying to push teams up front to hypothesize, all right, this is the population we're looking with, you know, these are the contexts in which we're working. What are some things that may or may not affect the way people are able to benefit or not from what we want to try and target? So, and then are we actually collecting data that helps us measure that? So that's one thing, right? We can hypothesize it, but if we don't collect any information, then we don't know whether or not. And I think sometimes it's also, it has to be, that's just where the iterative, you see something, you figure it out, oh wow, that didn't, why, can we figure out why it didn't work? You know, can we go back and look at some aspects, or does it tell us we need to measure something else or focus on something else in the next cycle? I don't think there's a real, and there's not like one, but I think the addition of that moderator, and it's been interesting to work with some teams that a lot of teams when they sort of engage with this particular theory of change model, that moderator piece is often where it's like, oh, it's opening new ways of thinking or seeing kind of how we need to understand the program and what might be affecting, what it is. A lot of the moderator stuff then is what, and we're starting to have enough data in that shared data repository now, where the team is starting to run some aggregate analysis. And often it's the moderator stuff that is what they're looking at. So they were just showing some slides this morning where they've looked at 5 or 6 programs that are all measuring parental stress using the parental stress index and doing simple just sort of pre-post kind of data they were showing. And so one of the things they looked at was for adults who reported child maltreatment on the ACEs, what would, and so there was of an aggregate of 4 programs, a very clear distinction between, those that had reported maltreatment had basically no impact. Those who hadn't had significant impact in the reduction of their parental stress on the measure. When they broke it out by program, there were very interesting differentials. So you could start to say, well, if we're working with this kind of population, we want to reduce stress. Here are 3 intervention models with different strategies. This one actually increased the parental stress of people who had maltreatment. This one reduced it, not as much as the others, but so you start to be able to get back to that kind of modular, how do we put the pieces together in ways, and this is early. I think, we're really just beginning to be able to start to really have enough data to start to at least for learning purposes. None of this is producing sort of evidence yet, but at least it's starting to give us some insights and learning about how we might start to approach some of this in terms of really trying to get a lot more precise. So it's interesting.
And I think it's a good exercise, like for a refugee program, our conceptual model sort of has the risk factors, the components, and then our outcomes. But we don't do a good job mapping the mechanisms. And with that same intervention, we've actually had outcomes like decrease in child depression, but no evidence that the mechanisms got engaged. So if you look at the measure of parent-child communication, there's no significant difference between the groups, but we reduced child depression. So it's operating, but possibly not by the mechanisms we hypothesized, or the truth of that study is just super underpowered. It was 80 families, only 40 in the intervention, 40 in the control. So you'd expect maybe you would see effects. Some people have argued that for mechanism work, you need bigger sample sizes sometimes. I don't know if you guys have gotten into that, but
I'm sure those who actually know that have, and I'm happy to sort of take that question.
Especially if you're trying to look at all your data at once and map it in that way, that there are power issues.
No, I think we're being, and in fact, now that we've got a number of pilots who kind of finished several cycles with us and are sharing results, our team is all of a sudden having to give them some real guidance about what they can and can't say about their evidence of what worked, which is because they're not powered, right? These are still early pilots. And so some modesty about here's what we're seeing here, but this isn't, we can't call this an evidence, in the same way that you can when you have an appropriately, rigorously structured and powered sort of study. So I think there's, we're trying to maintain a sense of appropriate modesty about claim. And it really focusing on that this is, it's about learning about the impact or not. And so that, so that's, as you said, that's a really interesting learning question. It's like, well, we got this outcome. We have no idea what it was in there. And
there's no signal in the mechanism.
Right.
It's clear, not a clear signal in the mechanism. Like if it works, you see the mechanisms engaged and you get your outcomes, right?
And so does that mean, let's go back and look at that population and break it apart and look at it and say, is there something moderating the mechanism? Or, wow, there was a hidden mechanism that we weren't, in our strategies weren't hitting, but somehow was getting hit anyway. Right. What is that? And that could be the thing that if we're redesigning, we're actually focusing something that's really going to kind of go after that. Those are the kind, right? And that's the kind of cool, interesting process of, oh, wow.
Yeah. The other critique, and because we've looked at and talking with Phil Fisher about we did this with Sugita Mayango, there were one intervention, we spoke with Phil Fisher, and our batteries are already long because we're measuring. You can imagine this is an early childhood home visit intervention for kids 6 to 36 months with families in extreme poverty. So you can already imagine all the stuff that's getting measured when it comes to
child development, parent-child interaction, nutrition, health, hygiene, poverty. That's in the battery just because that's the kind of family mechanisms, of the intervention. If you look module by module, what we say we're doing, do we have, appropriate mechanistic, measurement for each of the components that's in there? By the time you're done, the parents would be doing 3 days of assessments. So it's also like a parsimony.
Stress.
No, there was a joke, and it's a real case. One of the early, it's a couple of guys in the room today. They ended up having like a 2-hour set of like pre and post forms and things that the participants had to do for what was a 20-minute.
Yeah.
What was a 20-minute tablet-based intervention? You're like, quick feedback was,
At least our intervention's longer.
the quick feedback, this is infeasible. Right. So that's it. And you can't measure everything. And so again, this part of this iteration helping you hone in on if we have to choose across the 8 mechanisms we think we're hitting, we think these 3 are the ones, and then our best bet is if we measure those.
Right.
And that's not too burdensome, and we can actually collect that data and work with it. That's enough. And clear enough that that's connected to our outcomes, and we can kind of
Exactly.
and
That's a real issue. What I do think you all would love about implementation science, as a field is, and what we've enjoyed is this focus on other levels of influence, like the agency level factors, about buy-in, about leadership, about burden on the frontline worker in terms of their sense of support, inclusion, demands on their schedule. So starting to also look at those voltage drop. I think we share this interest in, like, why do we have this evidence-based thing, and then it doesn't get scaled and sustained in quality, and you see voltage drop. So it had these effects, and now when it's in the real world, it doesn't. Or the slow cycles, they say NIH, it takes 17 years to get from the early development of research to deployment. Implementation science is trying to address those things for sure, but also these issues about sustainment of evidence-based practices. So after all this thoughtful work, how do you get the evidence-based practice to be, funded, sustained? And so, there are a lot of people within the field of implementation science who are looking at issues of agency level factors, stakeholder buy-in, leadership questions. So I would wonder over time if you guys might iterate in those directions.
Well, and the other thing is we've just started, I have a first cohort of 6 project teams that are in what we're calling a kind of transition to scalability phase, where a lot more of those kinds of questions start to come in, like how you deal with, what's your business model? Who's actually going to deliver this? What are the IP issues you got to deal with? What are all those kinds of things? And so I think you get into more of the kind of implementation kinds of questions. And I don't know what they're drawing on and what expertise. I should share it. I think you all would find it interesting. So we have a set of core and recommended measures for teams that are in the portfolio. So those we're providing technical support for. So I'm happy to share that. And so the recommended measures are broken down by construct. So depending on what you're targeting and what you're doing between sort of caregivers, kids, and diets, and home environment and stuff like that. And then the core ones are like the ACEs, just basic demographic stuff. There's a participation tracking tool that they've developed. And
Jenna's like, don't give us any more good tools.
and the brief for parent executive functioning.
Yeah, we're using disturbances in emotion regulation, executive function.
We looked at both the DEFs and the briefs for the.
Yeah, didn't we keep part of the DEFs? Yeah.
So anyway, so those are kind of, because based on the science, the executive function stuff is stuff that's in a lot of what we're looking at. So we decided to make that a kind of core one. But it's,
And it's actually in our
But what I'm
doing that, we call it problem solving. But yeah, do we capture them? Did they problem solve better? The mechanism is engaged, thus you get the outcome. That's more complicated.
I'll take this back to see if in the kind of implementation science space, if there's some of these kind of methodological or assessment kinds of tools that we're either tapping into or we're interested in.
Yeah.
And that we might get back and say, hey, you use
We'd love to help. Yeah, we're
on that side.
very much in that community of practitioners in implementation science. So we'd love to make those bridges.
Okay.
And it'd be great to see your core tools because we're kind of measures junkies and like to learn about what's happening.
and very confessionally, these are have been developed as a set of recommendations for teams working very much in a North American context. And so, The other thing though is that in Saving Brains, we've been building out a bibliography of tools that based on kind of validation and adaptation in different countries and contexts. And so we've just finally gotten recontracted for that work.
Oh, that's
So
good.
it's starting up again. So anyway, our colleague is actually based in Nairobi who does that work. So she's going to continue to kind of build out that bibliography. So I'm happy to.
Yeah, we'd be keen on all that because we want to just learn from others' experiences. We've been talking to Grand Challenges Canada and Carly Silver again now that we're in the cluster randomized trial in Rwanda and want to think about transition to scale with co-funding, you know, what that could look like, because we'll be queued up after this trial for that, which we hadn't been before. So
Then we have a formal excuse story together.
exactly.
Yeah.
So we would love to have.
So our team, we are part of what we call a learning platform team that is expertise based here.